Everything you should know about the 2019 coronavirus, COVID-19, and how to prevent coronavirus. You've no doubt heard about the coronavirus outbreak by now that began in China, but has spread to the US, and you've probably heard that the illness can be deadly, and that face masks are starting to sell out, but you're not sure how concerned you should really be. You need facts, and we've got them. Here's an overview about what a coronavirus is, the specific details about the version of it you're currently hearing about, how potentially problematic it is, and what you can do to protect yourself. What is coronavirus? The name for this kind of virus comes from the crown-like spikes it has on its surface. Corona is Latin for crown. Coronaviruses are a large group of viruses that infect mostly bats, pigs, and small mammals. In rare cases, they are what scientists call zoonotic, meaning they can be transmitted from animals to humans, according to the US Centers for Disease Control and Prevention. How does it spread? Like other coronaviruses, such as the common cold, the virus is spread via droplets when a person coughs or sneezes. It can also be spread when someone touches a contaminated surface such as a door handle. Hospitals are also key locations for super-spreading events, when a single patient infects many people. When patients arrive in hospital with vague respiratory symptoms, health workers may not know they need to take special precautions such as wearing masks or keeping them away from other patients. The outbreak originates from animals, and the source is thought to be a seafood market in Wuhan, which also traded in other live animals such as marmots and bats. Symptoms of coronavirus. The viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache, and maybe a fever, which can last for a couple of days. 3 to 4 out of every 10 patients infected with MERS died, according to the CDC. Severe acute respiratory syndrome, also known as SARS, is the other coronavirus that can cause more severe symptoms. First identified in the Guangdong province in southern China, according to the WHO, it causes respiratory problems but can also cause diarrhea, fatigue, shortness of breath, respiratory distress, and kidney failure. How can you prevent coronavirus? The best thing you can do to avoid getting affected with COVID-19 is to wash your hands often. Use plain old soap and water. An alcohol-based hand sanitizer works well if you're not near a sink. This will get rid of the virus on your skin if you come into contact with it. If you need to cough or sneeze, do it into your bent elbow or a tissue, then put the tissue in a closed trash can and wash or sanitize your hands. Stay 3 feet away from people when you talk to them, especially if they have respiratory symptoms or a fever. This way, virus droplets from a sneeze or cough won't be able to land on you, and you won't breathe in the virus, either. Should you wear a mask? To walk the dog or go to Target? No. If you're sick, though, or if you're going to around a lot of sick people, like if you're visiting a friend in the hospital, it can be a good idea. In these situations, a mask can protect against other viruses as well. Here's how to properly use a protective mask. Wash or sanitize your hands first. Don't touch the mask while you're wearing it, and don't reuse it. Put on a fresh mask each time you use one. Take the mask off from behind. Don't pull it off from the front near your nose and mouth. Then throw it away in a closed trash can and wash or sanitize your hands. Treatment of coronavirus. Though there are potential therapeutics, but there are no specific treatments for coronaviruses, just as there is no treatment for the common cold. Peter Hobby, professor of emerging infectious diseases and global health, at the Center of Tropical Medicine and Global Health at the University of Oxford, said the disease bore all the signs of a classic viral pneumonia. There are currently no antivirals for this, so care is just supporting the lungs and other organs until patients recover, he said. There are other potential therapeutics out there but no effective antiviral, he added. According to CNN, researchers in the US and China have already begun working on a vaccine, thanks to China's prompt sharing of the virus's genetic code. However, any vaccine will not be available for up to a year and would most likely be given to health workers most at risk of contracting the virus.